This conference will now be recorded.
Hi, thanks, Melissa, and thank you everybody for joining. I'm going to share my screen and start our abbreviated presentation and really welcome questions afterward. My name is Katie Stanford. I'm our assessment specialist within the Whatcom County Health Department, and I'm really happy to be exploring the impacts of COVID. We've all known and felt these throughout the entire pandemic. We've all heard stories about the ways lives have really been upended, and we've experienced this ourselves. To understand this more comprehensively about how the pandemic has had impacts, we've conducted this assessment to study the changes it's had to the very foundations of community health and well-being. It's important to recognize that the pandemic had public health effects beyond disease burden and case rates, as we all know. This slide displays the population health framework, which guides our assessments and describes how we measure community health. And it's clear that the social and economic factors like education, housing security, community safety, and employment have strong ties to public health, and in fact account for about 40% of what makes up a community's health. Since we couldn't describe or study every impact by COVID in this earlier report, we've limited our assessment to the priority areas identified through the ongoing community health improvement process for two main reasons. First, there's ample evidence that shows that these are key priorities and determinants of community health. And second, that there is community-wide recognition that these are important local issues with persistent challenges. We do this knowing that there are other important aspects of the pandemic that we haven't studied yet, including the impacts on older adults in isolation, food insecurity, and family violence. And we look forward to studying this in more detail as we move along. So the areas that we did examine include kindergarten readiness as an indicator of family and child well-being, childcare as an indicator of employment and economic opportunity, housing security, the ability to retain safe and stable housing as a health determinant, which we examined as distinct and different from homelessness, which includes our crisis intervention for our unhoused individuals and families in our community. And lastly, we research behavioral health impacts. This includes both mental health outcomes as well as substance use behavior. And what you'll see in the report is a compilation of quantitative data, statistics and graphs, and qualitative data, interviews and focus groups that were synthesized to describe how COVID-19 has impacted these 5 community health priorities. We began by taking a look back at the same data that we used for our 2018 community health status assessment to see if and how any of these things had been changed by the pandemic. And this assessment represents a snapshot in time. So we absolutely expect that things will continue to change. What we've found so far is that the pandemic has negatively impacted some of the basic drivers of health, access to childcare, education, and housing. And it's had negative impacts on health behaviors like substance use and mental health outcomes. For young children to experience well-being, we know they need to live in families and communities that have the conditions in which safe, stable, and nurturing relationships can flourish. This sets them on a path to lifelong well-being. Kindergarten readiness is an important indicator of community progress towards supporting the conditions that promote this child and family well-being, and it's a revealing gauge of inequities in our community. As this slide shows, disparities in kindergarten readiness scores existed before the pandemic and highlight system inequities and failures. Local educators report that these problems have persisted and deepened over the course of the pandemic, with families and youth experiencing different levels of learning support in such a different environment, participation in formal education, and their academic success. Our education leaders tell us that this isn't a representation of the competence of our 4-year-olds. This reveals how our community support systems are really failing our kiddos. In addition to helping children learn and grow, affordable, high-quality childcare opens up doors for economic and educational opportunities for their parents and caregivers. This allows them to provide for the basics for their families. The temporary and permanent closures of childcare facilities that happened during the COVID-19 pandemic are worsening already known shortages of childcare spots. This graphic demonstrates that the amount of currently available childcare for kids under 5 needs to triple by 2025 in order to meet Whatcom County's anticipated childcare needs. Compounding the lack of childcare availability is a current and ongoing lack of childcare workers to meet even the existing staffing needs, making it difficult for family care providers and childcare centers to meet current needs for consistent care. And childcare struggles during the pandemic have created compounding difficulties for families. This bar chart shows that of survey participants to a 2021 childcare demand study, parents rated the largest COVID-19 impacts for their families as being increased difficulty balancing work and caring for children, that coming before reduced household income and worry and stress. Childcare demands have had a disproportionate impact on women in the workforce, with non-white women being the hardest hit. Also, Whatcom County has had a lack of affordable housing for rent and purchase that's both persistent and worsening, and like other communities throughout the United States, has systemic barriers for securing housing. This visual shows that the median home sale price has increased by 68% between 2016 and 2021, compared with only a 34% increase in median household income. And renters face a challenging housing market as well. In the spring of 2021, the rental vacancy rate was 0.8%, compared with a healthy vacancy rate of between 5 and 7%. And the average rent was $1,245 per month. Eviction prevention programs that have provided relief to many renters throughout the pandemic are due to end soon, and many renters have already received notices of rent increases. Homelessness. People experiencing homelessness are more vulnerable to a broad range of acute and chronic conditions and are more likely to have substance use and mental health concerns. This makes a lack of housing all the more challenging to work with. COVID-19 revealed how tenuous many people's living arrangements have been. This chart shows that the number of Whatcom County families with children awaiting placement into housing has increased by 77% between March 2020 and March 2021. More families with children have become homeless because they may have previously stayed with friends and family but needed distance living arrangements due to COVID, or lost employment and were not able to contribute to housing costs. The pandemic has also intensified the inadequacies of Whatcom County's emergency shelter system for people experiencing homelessness. The pre-existing workforce shortages and COVID-19 protocols both shifted and reduced services throughout this time. And behavioral health. The disruptions to stable housing, social connections, and financial stability experienced by many during the pandemic have had repercussions that impact people's mental health and substance use, and subsequently has had a major impact on entire families' well-being. We see that the demand for behavioral health crisis services has increased by 74% during the pandemic compared with before March 2020. And in addition, Whatcom County medical providers report an increased incidence in the number and severity of behavioral health issues across all age groups, including children and adolescents, both in the hospital and primary care setting. While it's useful to evaluate these topics separately, we know they're all integrally related. As we reviewed the data, we found overarching impacts that cut across all domains in our communities. One commonality across these impacts that we've just described are that all are related to fragile systems that we already knew were broken. We can't stress enough that COVID-19 only further exposed and increased the already persistent health inequities created by these systems. For example, if we consider many of the Latinx families whose livelihoods depend on farming or food processing facilities, we can see how health disparities have played out. Rates of COVID-19 infection have been higher for Hispanic individuals compared with white individuals in our county and beyond, and working conditions in these environments put people in close quarters and increase the spread of the virus. Demanding work hours made it challenging to get to COVID testing and vaccination sites, to take time or days off from work if one wasn't feeling well, or to stay home with a kiddo when a kid was sick or needed to quarantine and be home from school. Many of these families live in crowded living conditions, further increasing the risk of COVID-19. These circumstances highlight that the people who were struggling before the pandemic began have had a much worse time during the pandemic, with compounding struggles and impossible conflicts between employment, parenting, housing, and healthcare. And while there clearly have been significant negative impacts from COVID, we recognize that there have also been bright spots. We focused on caring for one another. This slide highlights quotes from individuals who were vaccinated thanks to the Lummi Nation generously donating and sharing vaccinations with the Ferndale community. And businesses and organizations adapted and innovated, quickly testing and implementing new service delivery models like curbside pickup delivery of prescriptions, telehealth options for behavioral health, and food bank deliveries. And collaborations across many service systems have supported efforts to address community needs holistically. And now I'll pass it over to Erica to close our presentation.
Thanks so much, Katie. Could you advance the slide, please? Thank you. I appreciate your time today. We appreciate your time today. And really, as Katie mentioned, this really is a snapshot of the information. It's a nearly 50-page document, just full of incredibly helpful information on each of these areas, and we encourage you to dig deeper by looking at the full report. It's available at whatcom.us/COVID impact. And maybe Scarlett, you could add that to the chat box so folks can easily access that. We want to thank the many organizations that contributed to this report. We have an incredible core team at the health department, but there were many organizations that provided their data and information, survey results, quantitative data, etc., so we could compile this report. And really the goal of this is to have all of this information centrally located and available to everyone, so it can be it can serve as a catalyst for our community to move forward and collectively solve these problems once and for all. These are systemic issues that require all of our attention, and they require resources, they require political will and energy, and the support of our elected leaders, our business community, our philanthropy and nonprofits, and the people of our community. So we look forward to sharing this more broadly. Katie and I will be presenting this to all of our philanthropic partners, to our business community, to every city council. And yesterday we presented this to our county council as well, / health board. So we hope to share it broadly and hope to work closely with our cities on how we can move forward with these priorities and really create long-standing, long-term, sustained change in these areas that we know impact the overall health of our community. So I think with that, I will stop, and we're happy to answer questions you may have.
Great, thanks so much, Katie and Erica. So we'll go ahead and pause here to see if there are any questions. I see Julie Shirley with the Bellingham Herald. Looks like you may have a question, so go ahead and ask your question.
Thank you. Were there any surprises for you in here? Was there anything in here that was directly COVID related, or were these made everything that was here before made worse by COVID?
I'll mention one thing that I think was maybe underappreciated before we started this report, and that's that in each of the sectors where we talked to our local experts, they all discussed workforce challenges in hiring credentialed staff. That was a bit of a surprise as we looked into this. That goes for housing, behavioral health, childcare, and those were mentioned as issues that really drove the continuing challenges, both long-term and short-term, for agencies providing support for our communities.
So that's hiring in terms of the agencies that would support these issues, not just general hiring.
Right, the agencies that would support these, so like counselors and for crisis support services, housing support staff throughout our community to help with housing services and homelessness services, and childcare workers, both for centers and family care providers. So just across the board, a real challenge in retaining staff for those high stress, especially during this time positions.
And I'll just add, that's a great point, Katie. And I'll just add, I think, you know, we all intuited many of these issues, and we've known that they were issues. I was surprised by the magnitude and the degree to which they have worsened since we did our community health assessment in 2018. Just on across the board, and not necessarily all related to COVID, but truly these issues are urgent, and they have become more urgent in the last just 3 years.
Thank you.
Thanks, Katie. Thanks, Katie and Erica. Any other questions for Katie and Erica related to the COVID-19 Community Health Impact Assessment?
Sorry, I can say that the emergency test system that the health or the sheriff's is working. I do have a question about just the process of the survey. Was this something that was already planned and already budgeted? It looked like a lot of staff time. There was a consultant involved. Do you have a cost, and was that something that maybe the COVID funding paid for?
I can answer that. This was a need that we identified while we were in COVID. It was not anticipated as was anything during COVID, but I think it was about February when we knew that there would be federal funding coming, that there would be political will and opportunity to address some of the pressing issues, and we wanted to be able to appropriately assess and determine some of these issues and how they had changed or become better throughout the pandemic. And so this process began just in March. And I will share this work, much of this work, all of the design work, all of the graphics was done in-house with existing staff. We did hire 2 consultants to help us move the work forward and help us with the writing. Because Katie is also doing all of our assessment work on COVID. So it was a heavy lift for our team, but we knew we needed to be able to provide the community with a real solid, albeit extremely heavy and really sad look at where we are with community health and how it's changed in the last few years. So it was really out of this experience and out of early survey and data that we were receiving about the magnitude of the change. I don't have an estimate of the budget, but it was fairly low budget because we did much of this work in-house.
Thank you. Sorry about the emergency alert there.
Okay, at this time, we will open up to questions about other COVID-related topics as well. If you do happen to come up with a question about the assessment, please feel free to ask that. The way that we're going to run the questions is that we ask folks to stay muted until you're called upon to ask a question. So if you want to go ahead and type your name and affiliation into the chat, we will call on folks in the order presented there. I see that we may have a question from Steve Kiggins to start off. So Steve, go ahead, unmute and ask your question.
Yeah, certainly. Thanks so much for taking time. Thanks so much for sharing your presentation. I wanted to ask about what the county's struggle might be continuing with reaching those that are unvaccinated at this point in time, and what the take might be learning that there may be dozens of local nurses protesting such a vaccine in just about an hour here in your community.
Thanks for the question, Steve. We have over time rapidly changed our strategy and approach to getting vaccine to people. We moved from a scarcity to abundance. We moved from large scale operations to smaller pop-up events, and we are really continuing to move to smaller scale events and activities, and encouraging our healthcare partners to have conversations in the waiting room and in the exam room about vaccine. It's really a one-by-one strategy at this point to get the almost 87,000 people who are still unvaccinated in our community that first and potentially second dose. I can't speak to Peace Health specifically, or the protest that's set to occur at noon today. I did hear about that, but I can't speak to their decision making or what's happening at that facility.
Thanks, Erica. Our next question is from Ryan Harris with Como Radio. Ryan, go ahead.
Okay, thanks for that, and thanks for having us. I appreciate that. Can you give us a quick snapshot of the state of the pandemic in Whatcom County now, like transmission levels and that sort of thing? And if there are any plans to do like some other counties in Western Washington and at least do a mask directive, if not a mask mandate, going back to public masking?
Thanks. I can give a snapshot, and Amy Hawkenberry, who's our health information and assessment supervisor, can help fill in the blanks if there are questions that I'm not answering for you. So Whatcom County is generally a little behind the curve. We were starting to see surges occur weeks ago in other counties around Washington State while our cases remained low. That has changed, and our cases in the last 4 weeks have increased by I believe about 500%. We now have all age groups at rates over 100 per 100K, which even just in the middle of July, those were around 30 to 40 per 100K. So quite a large change, a big dramatic increase. And now our 25 to 44-year-old age group is at over 300 per 100,000. So we are seeing a lot of transmission and spread within that age group. Likewise, our hospitalizations have increased dramatically. We had very few hospitalizations for weeks, and on Friday we had 13, on Monday we had 22, yesterday we had 25, today we have 26, and that follows generally that 3 to 4 week lag between a new surge and hospitalizations, but it's incredibly concerning given the fact that there are very few hospitals in the state that have capacity. So if you get in an accident, if you break an arm, if you have a heart attack, there are not places where we can easily transfer people to have those urgent and emergent needs met. And I know in talking with Peace Health that they're very concerned about the state of capacity statewide, and are working very closely with other partners to try to make sure that there's some capacity for non-COVID emergencies. So those are a couple of points. Amy, I don't know if you want to add anything else for that general state of things.
No, I think you've covered it.
Okay. Okay. And in terms of mask mandates or mask directives, there's lots of conversation among local health jurisdictions and the state. Our preference, of course, is for statewide consistency. If there are additional restrictions, it's very confusing, and it's always been confusing to have a county by county approach. But we are concerned about the trend that we're seeing, especially as we move to a very large fair next week, school starting in 3 weeks, and the fall coming very soon.
Thanks, Erica, for that. Ryan, did you have any follow-up questions?
You know, I did, because you talked about statewide consistency, and I know some counties have followed the governor's lead in terms of directing their own employees to get vaccinated. Others are assessing that. What's the plan for Whatcom County in terms of maybe requiring county employees to get vaccinated? And then I'm good. I'll give up my turn after that.
Okay. All I can say at this point is I have had a very, late yesterday, I had a very early conversation with our executive. He is in assessment mode, but no decisions one way or another have been made about that. But he is aware of other jurisdictions that are mandating that for their employees and is assessing that himself. But I don't have any more information about that.
Thanks, Erica. Looks like our next question is from Julie Shirley with the Herald. Julie's got a couple of questions here. I'll go ahead and just start with the first one, and Julie, feel free to jump in if you want to add to any of these questions. But Julie's first question is, any current outbreaks at long-term care facilities?
And as per our always policy since the beginning of this, we don't share names or specifics about any of our current outbreaks unless there's a general concern for the population. And I saw you also asked about vaccination events for now mandated worker vaccinations. We continue to have vaccination events in North County, in other places. We have not received a request for a special vaccine clinic. And I also just want to remind all that there are 50 vaccination sites around the county. So there's lots of different providers and pharmacies and options for people who need to be vaccinated with very little wait time and very little lag. So there's ample opportunity. There are ample resources for folks who are now mandated to receive the vaccine to find that vaccine for themselves.
Erica, I appreciate that you can't tell me who, but can you confirm if there are any outbreaks?
Let's see. Melissa, can you help me with that, or Amy Hockenberry?
Typically, Julie, we don't share any information about the number or locations of outbreaks, as Erica said, unless there's an elevated risk to the general public.
Okay, then can you talk about the fair a little bit?
Sure. The fair is, I believe it starts tomorrow and runs through next week. While there aren't recommendations or requirements for individuals to mask while outdoors, this is obviously a setting where there are lots of people in close proximity, and that creates additional risk. We have communicated with the fair organizers, and I know that they're doing what they can, but at this point there are not restrictions on attendance, and there are not restrictions with regard to masks. So we are a bit hamstrung in our ability to control the spread there without additional restrictions. But we will closely monitor whether or not there appears to be any resulting cases.
Thank you.
Erica, our next question is from Jessamine McIntyre with Q13 Fox. Jessamine, go ahead.
Hi, Erica. Thank you so much for your time. I actually was going to follow up on something that Deputy Director of COVID Response, Lacey Fehrenbach, revealed this morning when she was presenting to the State Board of Health about actually she was talking about ages 0 to 19 when she referred to children, but said that 18% of COVID cases are now occurring in that age group, which is just under 90,000 cases, but there have been 10 pediatric deaths as well. Do you know what the current case rate for ages 12 and under or 19 and under are in Whatcom County, and where it stands for hospitalizations as well? I was also going to ask about children's hospital capacities. Is there a shortage of ICU beds?
Thanks for the question. On our Whatcom County website, we have 9 different indicators with data, and it includes, thank you, Melissa, and it includes on tab 3, no, I'm sorry, it includes on tab 2, the case rates among different age groups. And I'm looking at 0 to 17, and it appears as though our case rate is right around 150 per 100,000 for that age group. It is not the highest, but it is not the lowest. Amy, do you have any other, I don't have the specific case rate. Oh, it looks like it's 124 per 100,000. So that's all available on the Whatcom County website that Melissa just included in the chat box. And I'm sorry, did you had a question about children's hospitals? Our
Yeah,
hospital,
I asked like 30 in one. I apologize for that. But yes, is there a concern about children's hospitals ICU bed capacity?
our hospital, you know, I think is a general hospital, given that we are a smaller community. But we, you know, this is a concern moving into the school year. Of course, we have seen nationwide that the cases and the severity of the cases among children, especially who've likely contracted the Delta variant, is worse than it was previously. And I don't know if our data team has any other information, but Amy, please pipe up if you'd like to add anything.
Yeah, I don't think I have anything to add more what you've covered right now.
Okay, did I answer all of your questions, Jessamine?
Yes, and I apologize for conflating them so much.
No, that's okay. That's okay.
Thanks for those questions. We've got another question here from Julie Shirley. Julie, go ahead and ask your question.
There's been some conversation nationally that testing times, which were down to like the next day, have tripled or quadrupled. Have we been seeing that in Whatcom County? I mean, particularly with the border, at least the Canadian side opening up and people here needing to be tested to go to Canada. Are you concerned? Have you seen increased times?
Yes, we are. We are, our site in partnership with Northwest Labs at the Bellingham Airport is at full capacity, over 600 people a day. And there are wait times. We are opening up more slots. We are trying to differentiate between folks who are symptomatic and folks that wish to go over the border. We want to make sure that people who are symptomatic have easy and very fast access to testing, so we can address those issues. But the border and the need for PCR tests prior to crossing the border have exacerbated an already increasing rate of testing in our community.
Thank you.
Any other questions for our presenters today? Okay, with that, I've added a link in the chat to a weekly report from the Washington State Department of Health about cases and deaths associated with long-term care facilities. That's in reference to questions about outbreaks and cases here in Whatcom County. So that's a resource for anyone looking for more information about that. With that, we are going to go ahead and conclude today's briefing. Thanks everyone for joining us. And again, the recording will be available in just a couple of hours once we've had a chance to download and upload it. Thanks again for joining us. Take care.
Thanks all.